So we're going to go ahead and get started. Continue on with the inflammations of the skin. So in your textbook, it's going to be page 2A3. Yesterday for review, we talked about primary, secondary, and tertiary lesions, as well as sebaceous and pseudoperipherous disorders of the gland. For today, we'll continue with inflammation of the skin, go over vascular lesions again, and then move into the next section, I believe, is pigmentation. So, can someone read dermatitis for us and what that is?
Various forms include lesions such as semen, vesicles, papules. Main categories of dermatitis are atopic, contact,
Seborrheic. So dermatitis, by definition, is an inflammation of the skin. Of the skin. It's going to be categorized into 3 categories. The 3 categories are atopic, contact, the rebirth we talked about yesterday. Do you guys remember what that is? Well, it is. But what kind of weather? It's like severe. Yeah. Oh, is it hot? Yeah. Oh, that's fine. Thank you. So, when you see inflammation on the skin, its medical term is going to be dermatitis. And then it breaks down into different categories as to why it came about. So our first is atopic. This is going to be a chronic relapsing form of dermatitis. Irritants and allergens trigger reactions that include dry, crackling of the skin. So an irritant can be something in the air that's blowing around that causes you to have a reaction on their skin. Maybe it gets on you, scratching at it, it gets inflamed, it gets irritated. Characteristics from an atopic dermatitis are going to be dry and cracking skin. It can also be accompanied with redness, itching, and dehydration. You use a humidifier that can help. Lotion can also help keep the skin more hydrated, and topical corticosteroids can relieve the symptoms. So we talked before about humidifiers just helping overall as far as breathing is concerned. Just breathing that in daily is really, really good, and putting different essential oils. Our contact dermatitis. Someone read that?
Inflammatory skin condition caused by an allergic reaction in contact with a substance or chemical. Contact dermatitis can be caused by either an allergic reaction or contact with the irritant. Makeup, skincare products, detergents, dyes, fabrics, jewelry, and plants can all cause red, itchy skin. Allergies to red dyes in products and nipple and jewelry are common. Allergic contact dermatitis is caused by exposure to allergens. Poison ivy is an example. A rash occurs when the immune system responds to allergens such as fragrances and preservatives. Irritant contact dermatitis is a localized inflammatory reaction caused by exposure to irritants, caustic irritants. Occupational disorders from ingredients in cosmetics and chemical solutions can cause contact dermatitis or dermatitis venata. Contact with all Contact with allergens and caustic chemicals can also cause skin sensitivity or disorder. Allergies and skin eruptions are common. Wearing gloves or protective skin creams while working with chemicals or irritating substances can help prevent contact dermatitis. Irritant contact dermatitis can become worse and lead to allergic contact dermatitis.
Contact dermatitis breaks down into allergic contact dermatitis, which is having an allergic reaction as far as like touching something, poison ivy. Irritant contact dermatitis is going to be more localized, so that's going to be in one spot, and that's typically caused by exposure to certain irritants that irritate the skin. That can be super just potent, if you will. Now that they get on the skin, it can be very irritating. And then you just have your basic products, materials, substances, and chemicals that can also cause action. So if you see redness, if you see itchiness, we already know that that's going to be a characteristic. Then not itchiness, redness or swelling is going to be a characteristic of dermatitis. Then if they're saying that it's itchy and maybe kind of bloody, or it seems really dehydrated as far as like having flakes and stuff like that, we'll know that it can be worse. So really good ways to help with people that have any type of inflammation is using a cooling product. So what is one product that you know that you have hit that will
Like a calming, it's not a toner, it's a calming.
Maybe the cleanser or that mask.
the colloidal mask will help. Also, Dermalogica has a product called redness relief that you can use on clients that get really, really red, after like a chemical peel or microdermabrasion or some other form of therapy that can heat to it. Then it's just good to wear gloves anyway. I suggest wearing gloves because these days things are crazy and it's better to wear them. Periodontal dermatitis is going to be an acne-like condition. Around the mouth consists mainly of small clusters of papules and may be caused by toothpaste, products used on the face. It's not contagious and antibiotics can help treat the condition. And then our favorite, eczema, which is also known as what? We talked about this yesterday. Dry skin, oily patches, but it's also a condition of the sebaceous gland, which is known as yes. What are the characteristics of eczema? Itching. What else?
Dry.
What else? Can it be oily? So an inflammatory, painful, itchy disease of the skin. It can be acute or chronic. Yesterday we talked about what those mean. In nature, with dry or moist lesions. And what is the term, or what is the definition of a lesion?
Any abnormality on the skin.
Abnormality or damage, injury to the skin. This should be referred to a physician. Avoid contact in skincare treatments if the client has eczema. Seborrheic dermatitis is a common form of eczema as well as the sebaceous gland disorder. So you'll see that some of the lesions crisscross into other categories. Characteristics by scaling around the nose, ears, scalp, eyebrows, and mid-chest area. This flaking mainly affects oilier areas. What do we think edema is? Swelling. So edema is the technical term for swelling. Swelling from a fluid imbalance in the cells or from a response to injury, infection, or medication. So can a papule have edema and infection? If it's in its
Secondary? Primary, okay.
no. Can it have swelling and pus, a papule?
No, aren't those the ones that
If
we
it's
have?
in its primary stages.
But papules doesn't have the pus, right?
Right.
The swelling.
Right.
Okay.
Because what are papules?
Inflamed elevation.
Can a pus have, or can a pustule have edema and pus?
Yes.
Because pus is in there. And so then we move on to erythema, which means redness. So edema, erythema, all of those are the technical terms that we should be using from here on out when we are referring to lesions on the skin. So if something's red, that can also mean it's what? Yep. So which means they already have dermatitis going on. But we have to figure out why. Was it something that they touched, something that was in the air, an irritant? What caused it? Folliculitis, that is going to be hair that grows under the surface instead of growing up and out of the follicle. If you guys remember my little picture, who normally suffers from folliculitis?
Men or people who shave?
They do, but what type of hair?
Or curly?
Curly hair. Why?
It goes back into the skin.
Goes back into the follicle.
Um,
So hair grows under the surface instead of growing up and outward of the follicle, so the hair shaft rolls over versus coming out onto the surface, causing a bacteria infection. And if you remember, acne oftentimes starts in the sebaceous gland because of too much oil, which can cause bacteria, the skin not being oiled enough, and dry skin cells piling up, all that stuff. These ingrown hairs are common in men, usually from shaving, referred to as barbi folliculitis or folliculitis barbi. They also get it because a lot of men don't shave with sharp razors. They shave with too many razors, so the razor can be dull. They shave with too many, and they're not shaving in the correct hair. Typically, when you shave against, not necessarily with. And so when they're going in certain directions where the hair is not growing, because a lot of times if you have coarser hair, it's going in all sorts of areas. So when that happens, they can cause friction and cause like dead skin cells that they already have in the razor. They push it back over into the follicle. Pruritus is the medical term for itching. What do we think psoriasis is?
Red patches, it has like a silver
White scales. right? Patches. Okay. This is caused by the over proliferation of skin cells that are replaced too fast. Psoriasis is usually found in patches on the scalp, the elbows, knees, chest, and lower back. If patches are irritated, bleeding can occur. It's not contagious, but it can spread by irritating the affected area. So again, in chapter 5, you learned about localized and generalized conditions or disorders in the skin. That is part of the reason why we do a consultation, to make sure that if something is in one spot, we don't spread it to the client in another spot and make a general disease or condition, a local disease or condition a general one. Iricardia is going to be hives. This is an allergic reaction by the body's histamine production. So antihistamines, anti-inflammatories, all those things are receptors that we naturally have in the body. We can also take them topically or orally. So those are going to be inflammations of the skin. Now we're going to talk about vascular lesions. What is the other term for vascular lesion? That is a type of a vascular lesion. Tertiary. And what are the 3 vascular lesions that we talked about yesterday? Rosacea. What did we say? Rosacea, what else? Oh, telangiectasia, yeah. And what else? And varicose.
So vascular lesions are the tertiary.
Uh-huh. Okay, so what's after the vascular lesions? What's the next category?
So, cancers.
Cancer or pigmentation?
Oh.
Pigmentation disorders. So, what are some pigmentation disorders? What's a really common one that most of us struggle with? This. Vitiligo. What's one that most of us struggle with? From sun damage or yep, also could be considered a blemish. Hyperpigmentation. What is hyperpigmentation?
Overproduction. Overproduction of pigment.
Production.
Abnormality, or pigment.
And what does that mean? And if that happens, that can leave more what? Dark.
Happens to my face.
So on the flip side of hyper, what do we think the opposite is? Hypo, which is going to be so if it's a lack of pigment, it's going to be
Like,
can you see hyperpigmentation in lighter Fitzpatrick types? Lighter Fitzpatrick types? Can you see the darker Fitzpatrick types?
yes.
Yes, we know it's
Can you see hypopigmentation in lighter Fitzpatrick types?
not very common.
What about in darker Fitzpatrick types?
Yes.
You can see it in both. It depends on the damage that occurs. So you can see hyper and hypo in lighter Fitzpatrick types, hyper and hypo in darker Fitzpatrick. It just depends on what caused it. Okay. We also have chloasma. What's another word for chloasma? Yes. And who typically has liver spots?
The darker Fitzpatrick.
Increased pigmentation from sun exposure or pigmentation from other causes. Melasma is a type of chloasma which appears during pregnancy. They call it the pregnancy mass. They can be helped by exfoliating treatments or by treatment by a dermatologist. Your liver spots are usually seen in your more mature clients. Starts to come out as we age. Oftentimes we'll see it on the hands. You'll look at like a more mature person and they're probably in their 70s or 80s. You can often tell people's age by their décolleté, so their neck, their décolleté, their hands, and their eyes. Eyes are always going to wrinkle first, or be the first to wrinkle on most people. So chloasma is liver spots. This is increased pigmentation from sun exposure. We already talked about hyperpigmentation. Lentingo is a flat pigmented area similar to a freckle, small yellow-brown spots. Lentin genes are multiple freckles. They result from sunlight exposure. Our liver spots called actinic or solar lentin genes. So they're the same as liver spots, but they have they're also called actinic. Freckles are tiny round or oval pigmented skin or on areas exposed to the sun, referred to as macules, which we learn as our primary lesions, which are what? What are macules? Freckles, or by definition,
Small tumors.
flat, blank, blank.
Hi, Ashley.
Hi.
Hi, sorry to interrupt, but is there any way you can adjust your camera so we can see the board? I see like the white part of the board. Thank you.
A flat spot or discoloration.
So what is that?
Um,
Or
A flat spot or discoloration on the skin, such as a freckle or a red spot left after a pimple has.
what is the technical? which are freckles, which are also known as, can be called liver spots or lentigines due to actinic exposure or sun exposure. What is melasma?
Dark spots that pregnant women,
We call this the pregnancy mass. This happens due to hormonal changes or hormonal imbalance. Some people, it usually clears up after they have a baby, but sometimes it doesn't, and that lasts. What's a nubus?
once more.
It's a malformation of the skin from abnormal pigmentation or dilated capillaries. Do we have any nubuses in here? Anybody born with birthmark? What's the stain?
Brown or wine color discoloration.
With a circular or irregular shape. A port wine stain is a birthmark, which is a vascular type of nubeus. Stains may also occur after certain diseases. And last but not least, a tan. Darkening. And you. Oh. So you have more overproduction, pigmentation disorders than you do have underproduction. So usually it's more stimulated, producing more pigment. It is under. Okay, moving right along. Okay, so we talked about hypo. We have the lack of, which is going to be albinism, leukoderma, and vitiligo. What's albinism?
Like a pool.
It's gonna be a rare genetic condition characterized by the lack of melanin pigment in the body, including skin, hair, and nails. You can see it, like, I almost have like pale face, if you will, the eyes, all that. You can tell that the color is missing. This person is at risk for skin cancer. They are sensitive to light and ages early without normal melanin production. Melanin protects us from the sun, just like oil helps us from aging. So typically, the more melanin you have in your skin, younger, and you have more protection from the sun than people that have less melanin. Leukoderma is a loss of pigmentation as well. This is going to be light abnormal patches. Loss of pigmentation, light abnormal patches of depigmented skin. Congenital, acquired due to immunological and post-inflammatory causes. Vitiligo and albinism are forms of leukoderma, are considered leukodermas. And last but not least, this is going to be a pigmentation disease characterized by white, irregular patches of the skin that are totally lacking pigment.
And albinism, and vitiligo is a form of leukoderma.
Mm-hmm. All right. And last but not least for today, we're gonna go over hypertrophies. Then have a little review. what's a hypertrophy?
And abnormal growth.
Hypertrophies are defined as abnormal growth and they include the following. Hypertrophy is an abnormal growth that usually is benign or harmless. However, some growths are pre-malignant or malignant. And what does malignant mean? Cancerous. And can be dangerous or cancerous. Hypertrophic is used to describe thickening of the tissue. The opposite of a hypertrophy is atrophy, which means wasting away. So you guys have probably seen pictures where people's flesh is kind of eaten in that. That's an atrophy. But then if there's like an overextension or there's a buildup, that could be considered a hypertrophy. I just read that. Keloids are examples of hypertrophies. So you guys remember we talked about keloids being in our primary or secondary lesion. Secondary lesion. Why? Because it's after the tissues have
Change the structure.
actinic keratosis is a pink or flesh-colored precancerous lesions that feel sharp or rough that are a result of sun damage and should be checked by a dermatologist. Hyperkeratosis is going to be the thickening of the skin caused by a mass of keratinocytes. If you remember, our keratinocytes start out as keratinocytes, and they eventually become corneocytes as they make their way all the way up from the bottom layers of the skin to the top layers of the skin. So we have keratin. Our skin is made out of keratin. So is our nails, and so is our hair, soft and hard keratin. Too much of that or too much production of that could be hyperkeratosis, which is going to be a thickening. Can someone read what a keratoma is? Bless you.
Why is it thinking much to them?
I'm sorry, I don't care too. Alright. So what is another name for a keratoma? This is also see a lot of people's feet.
The corn.
Not a corn, the other C word.
House.
Who's that big patch of what?
I think it's smear because I wrote it before. Keratosis is an abnormal thick buildup of cells. Keratosis piloris is redness and bumpiness in the cheeks or upper arms caused by blocked follicles. Exfoliation can help unblock follicles and alleviate the rough feeling. Exfoliation can also help with the thickening patches of the skin, the thickening patches of the cell, all that good stuff. A mole, which is also in the category of pigmentation, because it can also be considered a birthmark or a nuvius, is going to be a brownish spot ranging in color from tan to bluish black. Sometimes people have red moles or flesh colored moles. They could be flat or raised. Some look like freckles, others are raised and darker. Most are benign unless they start to grow, elevate, bleed, change in shape or diameter. But changes in a mole color or shape should be checked by a physician. Hairs and moles are common and should not be removed unless by a physician because it may irritate or cause structural changes to the mole. And sometimes moles can be attached to your nerves. So you can cause skin tags. What are skin tags? Can somebody read that for us? I'm gonna jump up at one.
Small unattached or extensions of the skin that look like spots. They are benign and are common under the arms, around the neck, from friction or with skin.
Yep. So these little doodads are just little extensions of the skin. They kind of look like little flaps, if you will. You often see them under the arms from the arms rubbing, or if somebody wears a turtleneck and it's rubbing their neck all day, they could develop skin tags. And then you also see it in people that are severely overweight because of all the friction from the skin flapping or touching together. A really cool way to get rid of skin tags is chemical exfoliation. I used to have a whole bunch on my neck. I really don't know why, but I did, and I discovered when I was getting chemical pills that they will dry the lesion out, and then you can twist it off. All right. What is verica or Eureka? What is that?
Ward.
Yes. How do you get warts?
And then caused by a virus.
Yep. And there's different types of warts. You have warts, you can have hand warts or warts on your feet, plantar warts. You can also have genital warts. Warts, are they contagious or not contagious? They can be contagious. You can get rid of them through sometimes antibiotics and then through surgically removing them.
Are all, verrucas caused by?
Most warts are caused by virus. So it's a hypertrophy of the papilla. If we remember, what does the papilla do in the follicle? So it's an abnormal growth of the papilla. So what does the papilla do? Say that again?
Is it where the hair is a follicle growth in that follicle?
That's the bulb. What does the papilla supply the bulb or the follicle?
Next. Makes the follicle to the dermis.
But what's its main supplies the nutrients? So it's going to be an overextension of what? Because where does the nutrients are? Or fluid, but how do we get it throughout the body? Through our blood system. So basically, you can get a virus from body milk, only God knows what. And then it happens to be in the skin or in the follicle, if you will. And as it continues to grow and elevate, it changes the structural composition of the populi, which is how we get our. All right. Last but not least, contagious diseases. Conjunctivitis, what is that? How do you get pink eye?
Viral.
Viral?
Bacteria.
Bacterial. So bacterial getting in the eye. Did you work on somebody that has pink eye?
No.
Why?
Thank you.
So those of you that want to do lashes, be out on the lookout for that. Make sure your eye, if your clients are coming in, they don't have like a mucus around their eye. It's not bloodshot or red. There's no bugs coming out of their eye, anything going on. Inflammation of the mucous membrane or the conjunctivi around the eye due to chemical, bacteria, or viral causes. It's very contagious and it's usually treated with antibiotics. Herpes simplex virus 1 is going to be our fever blisters or cold sores. This is a viral infection. A vesicle or group of vesicles. What are vesicles? What are not? But what kind of box? Small blisters. On a red or swollen base. The blisters usually appear on the lips and or nostrils. Herpes simplex virus 1 causes cold sores and lesions around the mouth. It's very contagious. Herpes simplex virus 2 is your genital wart, not warts, I'm sorry, herpes. You will find that most diseases and disorders break down into various other categories that go far beyond our little esthetician ways. Genital herpes. Never work on clients with a current herpes lesion. Pills, waxing, or other stimuli may cause a breakout, even if the condition is not currently active. The virus can be spread to other areas on the person that is infected or to other people. Understanding a client's health history from their intake form may prevent potential problems. Your last form is your herpes zoster. This is going to be your shingles.
shingles was caused from something else. Chickenpox.
A painful skin condition from the reactivation of chickenpox virus, also known as Varicella zoster virus, VZV. Shingles is a viral infection of the sensory nerves characterized by a group of red blisters that form a rash that occurs in a ring or line. The rash is typically confined to one side of the body. BZV can cause nerve and organ damage and severe pain that can last for months to years, treated with antiviral drugs.
So is chickenpox technically a form of herpes?
Because it's like what you get after you have chicken. Impetigo is a bacteria infection of the skin that often occurs in children. It's characterized by clusters of small blisters or crusty lesions filled with bacteria. It is extremely contagious. And you usually find it only in kids though. Tiana, anytime you see TINEA, that is going to mean fungal. So that is the technical term for fungal. We have to know about our bacteria, our fungi, our parasites, and our viruses. Tiana. Sections. Fungi feed on proteins, carbohydrates, and lipids in the skin. Those are our micronutrients. Tiana pedis is athlete's foot. It is a fungal infection. Enzymes can help kill funguses. If you pee on your foot and you have athlete's foot, you can cure it because the enzymes in your pee will eat away at fungus. Tiana corpus is ringworm. That is another type of fungi or fungus. When drink kombucha, I'm drinking kombucha, so I'm like yeast, fungus, all that good stuff. Yeast is a form of fungus, mold is a fungus, mildew. Um, Highly contagious, it forms a ring, red pattern with elevated edges. A lot of kids get ringworm, being young, dirty, around the way, playing on playgrounds and stuff. And then we have our great word again, wart. Hypertrophy of the papillae and epidermis caused by a virus. Infectious and contagious. Varicose can spread. Wear gloves and avoid contact with other warts or with people really in general. And then a non-contagious is going to be your Tiana vascular. That is going to be a fungal condition that inhibits melanin production. It is not contagious because it is caused by yeast and yeast, a normal part of the human skin. It is characterized by white, brown, or salmon-colored flaky patches from the yeast on the skin. The sun fungus can be treated with antifungal creams or medication. Cellulene sulfide shampoos can also treat the condition. highly humidity and summer heat stimulate the condition. It usually fades in cold winter seasons and reoccurs in warm seasons. Any questions? All right, so I have a little review for you guys. Without your notes, so the best bet to memorize these or learn them is I would make some flashcards. I think there's some on Cengage. If you want some like handheld ones to help you, because it is a lot of terms. Okay. Notes away, Alexis. Write on a piece of paper. Write out the question. You can just write one and the answer. Question 1, what is a primary lesion and give an example? Question 2, what is an example of a sebaceous disorder? 3, how many vascular lesions are listed in your text? 4, what is the difference between anhidrosis and hyperhidrosis? Last but not least, what's a common form of eczema? We know? You ready? You guys going to study also? That's the next Thursday. Tomorrow's your hair removal test. Okay, what is a primary lesion in the early stages? And what are some primary lesions? Papule, pustule, macule. Which one? Nevus, that's a pigmentation.
Okay.
What else? Where you at, Melissa? What else?
Yeah, I know.
Is Ebola a primary lesion? Ebola? No? It is.
It's not a primary lesion.
Yeah, it is. So primary lesions are lesions in the early stages, so they're just developing. Secondary lesions are what happened after the primary lesion has healed. So a scar is a secondary lesion, or while it's healing, a crust
After you already popped or gotten the oil.
has changed. Structural changes have occurred.
So the boil will be the first stage?
And then you could have a scar afterwards, which would be a secondary lesion. Or while it's healing and it has like a crust, that could also be a secondary lesion. The keloid is like a secondary lesion because it's all healed up. It's just an accumulation of fibrous tissue. What is an example of a sebaceous disorder?
Actinic keratosis?
That's a hypertrophy. Y'all are okay. So if we remember the sebaceous gland, that's oil. What are some sebaceous disorders?
So overabundance of oil produces acne.
Yeah, acne. Acne's one. Acne, cerebric dermatitis, cerebria, all of those are going to be disorders of the sebaceous gland. Okay, how many vascular lesions are listed in your text? Three. What are they? Yeah, no. Teamwork makes the dream work. Telangiectasia and rosacea. And what are some characteristics of rosacea? Because it's an inflammatory disorder as well. It's vascular and it's also inflammatory. So you could have dry or oily, which is also known as erythema. What's another characteristic of rosacea or an inflammatory disorder? Itchy. What is the medical term for that?
Pruritus.
Oh, there you go. Okay, and then what else?
And is it scaly also?
I'm looking for another medical term. You usually see redness, itchiness, and
Edema.
which is
Swelling.
swelling. Ma'am, what is the difference between anhidrosis and hyperhidrosis?
Anhidrosis is a lack of perspiration. And hyperhidrosis is a severe reduction.
And then what's the third one? Is what you don't want to have. Yes, a foul smelling. But what's it called? Bronchidrosis. You can't make me not be able to say it. Okay. What is a common form of eczema? I already told you guys just a second ago. No. Eczema. You said that with some confidence. No. What's a common form? Because it's also another type of disorder, which is psoriasis. No. So far we've gone over 3 types of disorders: pigmentation disorders, pseudoperiferous gland disorders, and sebaceous gland disorders. What does eczema fall under? So it's an inflammation of the skin, but it's also another type of this disorder. That's all I have, ladies. That's it. So tomorrow we'll take our test at 10 o'clock. It'll be chapter 18, hair removal, and then we'll finish with the chapter going over the cancers, acne, and triggers of acne and all that good stuff. Uh-huh. All right. All right, ladies, enjoy the rest of your day. There'll be a replay of this at 5:30 tonight.
Hey, Ashley,
Uh-huh.
the answer to the eczema question, it wasn't hyperpigmentation, was it?
No.
Oh, okay.
What kind of dermatitis? Cerebric
Um,
dermatitis.
cerebral. Okay. Thank you.
You're welcome. You ladies have a good one.
Bye-bye.
Bye.